welcome to the Flourish Community Podcast. I always love saying that. It's another week, and yes, you guessed it, another conversation. And I love this week because I'm not here alone. I'm sitting with Thaakira, who is an occupational therapist. And to be exact, she's a mental health occupational therapist. Now, what that is, you will need to hang out a little bit with us to know what that is. And the focus that I want to sort of like highlight this here for everyone is what the MDT is and what is the role of the MDT in psychiatry. So starting this month, we'll have different members of the MDT coming in, sharing their expertise and just like who they are. And if you go to a psychiatrist or if you go to a mental health clinic, what to expect, or if you see these members of the MDT, what to expect. MDT stands for multidisciplinary team. The whole thinking around mental health is that you cannot walk this journey just with one person. So if you're just seeing a psychologist, that's well and good, but sometimes what is going on in your life requires more members of the multidisciplinary team, or requires something different that the psychologist or the psychiatrist is not able to offer. So I'm really excited today for you to join me in this conversation, speaking to Thaakira Ismail Ibrahim on what the role of a mental occupational therapist is, where she practices, who does she see, and when does she see them. And she, if you stick around, gives us a little tips on how you can regulate yourself and come back to yourself. So I know you are going to enjoy this conversation, and as they say, please like and do subscribe. Share this with people in your life. I really think this is going to be useful, so that they have better understanding of what an occupational therapist, especially in mental health, what do they actually do. So see you on the flip side. I'm right by saying you are an occupational therapist.
Absolutely. Yes. Passionate. Love my job.
What is that, Thaakira? What is an OT?
Sure. Before I give a proper definition, let me tell you something, Sibo. If you ask any OT what they do, I guarantee you they are going to be like, sure, it's so difficult to explain, it's so difficult to give you a proper sentence of what an OT actually does, because it's so broad, it's so sure. And I think that is what makes me so passionate about it, because it's so vast. And I think the only time that you truly know what an OT does is actually if you work with one and you see actually the doing or the actioning of what an OT actually does. Because in essence, OT is very much focused on the doing, very much focused on activity driven. So with that being said, I think my actual kind of meaning to describe what an OT does is that I think in mental health, it's very much focused on a crucial link between meaningful activities as well as overall mental well-being. I think our fundamental belief is participation in activities, whether it is through self-care, through leisure, through work, or even social interactions. It's really essential, yes, for recovery, but it's those things that give people a sense of meaning, a sense of purpose. And if there's one keyword to take home from what an OT does, just remember the word practical. We're very much practical orientated. Yeah.
Okay. I love that. But in your training, can you tell us a little bit more about that? Because, in our training, we have interactions with occupational therapy students. And of course, in mental health, they will be doing their what is rotation, but also in other areas like internal medicine. So in terms of study, what do you guys study?
Sure. So, occupational therapy is a 4-year undergrad degree. And across those 4 years, we work or explore through 5 clusters. So, number one being, well, of course, mental health. Number two being physical health. We work in hospitals, people that have CVAs, which are strokes, orthopedics, working with children, pediatrics, so school-based children. Those are very like scholastic kind of difficulties that we also explore. Yes. The fourth one would be working in communities. So that would be working with an NGO, doing a lot of like program development, kind of seeing what initiatives can be built, can be run. And the fifth one being work practice, of course. So some people specialize in one of those particular areas. Work practice such as maybe working with either people wanting to be boarded, they have to go for a thorough full assessment, temporary incapacity, all of those kinds of things. So those are the 5 clusters that we explore undergrad.
Okay. And then when you come into actual practice, can you practice all of the clusters, or you do one?
So absolutely. So after that 4-year degree, you go into community service, which is where you get sent away and you almost give back to the community. And normally or generally, the placements are all-rounders, or try as much as possible to be all-rounders. And when you qualify, you are most likely you can still practice in all 5 clusters. I know a few OTs that doesn't want to only work in one specific areas, and they often then still locum and do a lot in all of the other areas because they don't want to lose that skill set as well. Yeah.
But you, Thaakira, have just a focus on mental health. How did that come by? Why did you choose to have a strong focus on mental health?
Sure. Sibo, when I was in undergrad, I still remember I was in second year, and that was when they, introduced mental health and kind of explored it. And I remember I was sitting in the lecture on that day, and I told myself, this is where I see myself. And I fell in love, I think, that time already with mental health. And I always told myself, you know what, maybe I'm still young, you know what, like let me just see. But I really think that mental health is for me. Third year was a full year on practicals where we then went to psychiatric facilities. Oh my word, I fell in love. Fell in love, and I was like, no. Plus, it was also my strength. So in terms of all the other clusters, it was my strength, and I actually did really well in that cluster. And I was like, no, this is a sign. This is something that I really see myself doing.
Oh, so there was passion, but there was also competency. And when the two meet, it's a bomb. So how does just being a mental care practitioner differ then from the other areas of OT practice? I mean, do you bring those other areas when you are seeing the patient, or it's just a focus on mental health? So someone whom I'm referring to you, because we work within a multidisciplinary team. We'll talk a little more about that. Like, what do they expect when they are going to come, and what should they expect when they're going to come and see you? Should they expect some of the clusters, or will the focus just be on mental health?
No. So as an occupational therapist, we look at the holistic being. So that has to do is where we assess and address areas such as the physical, emotional, cognitive, sensory, and social factors that may impact or hinder a person's performance in certain areas of their life. So when meeting a client for the first time, it's very much focused on all the areas of their life, because what's important for us is that function is the key word as well, is the fact that we need a functional human being. So we look at each area of their life and the roles that they play, whether it is that they are a student, whether it is that they are a scholar, whether it is that they are a worker, whether it is that they are a mum, a dad, to whatever roles or hobbyists, it doesn't matter. And we definitely look at the holistic being, because function is, we want to gain independence, a sense of independence at the end of our treatment.
I love that. I love that you did say the main operative word is practical. So the practical applications, how does this person function in the real world? So how would you say then you as occupational therapists contribute to the recovery of individuals with mental health challenges? What specific things? So you told us about function, but what would you look at if you could just give people an idea?
Yes, sure, absolutely.
Oh yeah.
Yes. So I think, one of the main or key things that we look at is we want to let people engage in meaningful activities by setting. Sometimes what we'll do is we'll set up a daily routine. We look at routine and structure, and we're like, what does your current day look like? And we'll sit and we'll unpack and create a kind of routine, especially for people that might struggle with organization, or people that maybe just have lack of motivation to do things on a daily basis, and we kind of, break it down into smaller steps, into manageable steps to slowly get back on track to be that functional human being. The other things that we'll look at is social connection. Sometimes, when we not feeling good on a specific day, we feel like, I don't feel like going out or anything like that. We look at small little things of okay, what about that close friend? How can we build new social skills? And we can look at those things as well. I think a key thing as well is about basic skills or coping skills that we also look at. So sometimes people struggle, with anxiety or just with difficult emotions that they don't know how to manage with that. And we sit and we look at different coping skills in terms of how to manage those emotions. Sure, I can actually go on if that's okay. Sure. And then the other things that we also look at is skills for independent living. So maybe it's things like meal preparation, or things like budgeting, basic life kind of skills, so budgeting, or even just basic hygiene. Maybe hygiene or basic self-care is a bit of a challenge, and we look at how to downgrade that and be like, we set small goals for ourselves to give that person a sense of empowerment, and let's say, let's try and do smaller things first to give us a sense of accomplishment, and then we grade and we do more thereafter. I think the last thing that I want to add as well is we also look at clients that might have sensory difficulties as well, especially those that suffer a lot from anxiety, is where sometimes people have sensory sensitivities. So certain light might be too much, or noise might be too much. And we look at certain strategies that how we can adapt the environment or modify the environment to meet the needs of the client. Yeah.
I am very biased when it comes to the multidisciplinary team. I'm a psychologist, but I just feel like I must have that OT. For all the reasons that you have mentioned, and thank you so for that. I think that was very comprehensive, and I'm hoping that people can write that down. Have a clear understanding, because a lot of people don't know. They don't know this stuff.
Absolutely.
And Thaakira, who comes to you? I know how we work, but maybe for the purposes of this interview, we can talk about, but who comes, what kind of patients come to you, and how can they get to you?
Sure. So, number one would be so sometimes when they see a psychiatrist or a doctor, then they work on a referral basis. I mean, I heard you said you'll chat a little bit more about the MDT and things like that. So often within an MDT, they will be referred to me. So clients that maybe struggle with depression, struggle with anxiety, or anything of those sort. But sometimes we also have self-referrals. So sometimes people are looking on social media or you heard about an OT through word of mouth from another previous client. And, they can, for me, for example, they can either contact me. I think it's easier on social media. So I do have a page on Instagram where it is Thaakira _occupational therapy. All my details on there. I have an email address, as well as a WhatsApp number. I often say to clients, you know what, WhatsApp is easiest. Just pop me a message, and that's how we can, set up an appointment or meet with an occupational therapist.
Okay, awesome. I love that. So it can be by referral by a psychiatrist, but people can also refer themselves to you, and you would take those patients. And tell me, with the referrals, like which patients if someone feels like they have anxiety, can they come to you? Which disorders do you see? Are you disorder specific, or just any individual who wants to explore routine scheduling and maybe do a sensory profile can come?
Absolutely. So based on the things that I've mentioned around routine, maybe difficulties with organization, maybe difficulty with basic life skills like budgeting or hygiene, meal preparation, anything like that, maybe just struggling with identity formation or still trying to get a sense of who am I, which I think is a key thing, especially in our adolescence as well, that transition between an adolescent and an adult, they often think like, oh, where am I,
Yeah.
So those struggles with social interactions definitely come, and we can arrange and we can meet, as well as sensory difficulties. If you notice that, sure, you've actually had a moment to check in with yourself and you're like, oh, but lighting has been too much. I've noticed I've been having headaches, or certain sounds make me feel overwhelmed. We can do a sensory screening. We can see, where are the strategies. So absolutely, it doesn't have to be a specific diagnosis necessarily. It can just be even just struggles with regards to some of those categories that I've mentioned.
Okay. I love that. I love that OT is not about diagnosis, because I think a lot of people feel, we were talking before we started this recording about the stigma just around mental health. So people tend to define themselves by their diagnosis. But what you're saying to us here is that everyone struggles, and you can have struggles in many aspects of your life or some aspects of your life, and there are professionals that can take you through that, break it down, and help assist you. Just, okay, how do I organize my calendar? And
Absolutely.
I love it because it's things, Thaakira, that we're not taught in school, and I think when people come to the clinic, they're like, oh, I didn't know you could do that. I didn't know you could set a boundary. I didn't know that you could, organize your routine or your day like that. And it's something so simple, but adopting that habit can literally turn your life around.
Absolutely. And I often say, what's awesome about our focus is that we work collaboratively with the client, with the patient. So the patient leads and we just help and guide, facilitate those things, because at the end of the day, it's their doing, it's their actioning throughout the day. Yeah. So we just help facilitate and brainstorm new ideas with them,
I love that. That's my favorite phrase with patients. I always say there is safety in collaboration. There's safety because, we cannot come in and impose, because like you're saying, in the end, they have to go in and apply everything that you have said. They have to go and do whatever you have told them to do. So if I just come in now and change medication without consulting with the patient, that is what leads to a lot of misuse of medication or stopping medication at the wrong time. And it's the same with occupational therapy, 100%. So MDT, people have been hearing us in this talk now for the past 15 minutes saying MDT. So what is your understanding of MDT? What does MDT stand for? Why is it important? Why must people who are in a mental health journey know about MDT?
For me, that, first of all, MDT stands for multidisciplinary team, okay? And for me, that collaborative work with an MDT is of utmost importance for holistic care and for effective care for a patient. I think it is so important that we communicate with each other, we meet with each other to meet the goals and the needs of the client so that we're all on the same page, so that by the end of the therapy journey, we can be like, sure, we've worked really well, we can see the change evolve within the patient. So MDT is of utmost importance, and I think each person definitely has a unique role to play within an MDT.
Okay. And so can you tell us about the members of the MDT that you usually work with
Sure.
when you work with clients?
Sure. So I've worked with, so it's myself, the occupational therapist. I've worked with psychiatrists, the doctor. I've worked with a psychologist. We often get a social worker as well. And we also sometimes get a dietitian as well, depending on the needs of the client. And with time, sometimes even the MDT can broaden depending on, again, like I say, the needs of the client. But most of the time, that is what my MDT looks like when I'm working with clients.
Okay, amazing. And each person has a different role. We will, during the course of this year, just introduce people to different members of the MDT, and they'll come and tell you for yourselves what do they do and when you can come see them. Because as much as this is collaborative effort, right? So we're working collaboratively, but you can also approach people, individually and be like, okay, I want to see this member of the MDT because this is what's happening in my life right now. Okay, so a lot of people often get confused between an occupational therapist and a psychologist. And now as we're flowing in this conversation, I'm like, but we must please let the people know so that we clear this. And I know there's a bit of beef between the occupational therapist and the psychologist. Can you explain to people what's the difference?
First of all, thank you for that question. Thank you. Because sure, it can get quite blurry, and I think lots of people are confused with regards to the difference between our roles. But remember that word that I said at the beginning, the practical word. I think, first of all, that needs to be your go-to always, to distinguish between the role between the psychologist and the OT. But with that being said, a psychologist is obviously more focused on the thought processes and unpacking, difficult things that people might have experienced. And I won't explain too much at length with that because, like I say again, that's not my role. But if we were to distinguish between the OT and psychologist, the OT will come on more the person's functional abilities, more around meaningful activities that they are engaging on a daily basis, and also figure out or kind of understand what environmental barriers are preventing them from engaging in those meaningful occupations. So, for example, if I can give an example to distinguish or to explain what my role would be within a team, would be, for example, I might see a client and we figured out what kind of environment is more conducive for the client. I would say, okay, guys, when so-and-so meets with the psychologist, can we make sure that the lighting in the room is a little bit lighter, or can we make sure that there is some ventilation and the person sits maybe closer to a door, or whatever the case may be. So I might say that in therapy sessions, I'm going to say, how does the structuring of the environment looks? Okay, maybe with the social worker, I'm going to say, I can recommend some ideas on activity-based approaches that the social worker might need for community reintegration. So yeah, I hope that gives some clarity,
I think that's very clear. So you make suggestions to the team on how they can work effectively with the patient, given whatever challenges they have in terms of sensory or social interaction or integration. So that's how you keep that collaborative loop going. So you're not taking the place of the psychologist. You're not looking at past trauma and processing that. That's not your place. I hope the psychologists can have peace from that. This is not what the OTs are doing in consultation rooms. They are actually there to help you connect better with your patients.
And we look at those, but our end goal is always what our engagement in functionality. So we won't look at the deep-rooted kind of traumas, that is the psychologist. We need to look at, okay, so this has happened, this has taken place, now I need to think about the doing, the actioning, the function, to be reintegrated into work, into at home or family or whatever the case may be.
Okay. No, I love that. And I think that's very important for people to have a clear understanding of. So, I mean, you've given us a lot of information now, who can come see you, when they can come see you, and you've also told us that you are not a psychologist, but you are an occupational therapist, and your role, I hope it makes sense to people, like what your role is in the sort of like MDT and how they can come to you. You've already given us ways of people coming to you and all of that. I want us to talk a little bit about emotional regulation, daily functioning, and identity formation. I think you mentioned some of these things. You talked about your role is really skills building in clients. So when it comes to emotional regulation, I think it's a very important topic that, like we said earlier, like I wish we were taught in school, just how you taught. Well, we're not taught how to learn. We're just given books to learn. And I think OTs can even help you with that in terms of how to structure your day so that you can learn effectively. So what is emotional regulation?
Sure, I think this is so important, and I think I'm very passionate again coming back to the adolescents. As growing up, we don't get taught at school or any ways, or even growing up at home, we don't always get taught how to manage our emotions. And I think if we were to define what emotional regulation is, it would just be, how can I figure out ways to cope and to manage with my emotions? Because sometimes our emotions can feel like it's out of control. Sometimes it can feel like our emotions are all over the place, and we just don't know how to cope with the intensity of those emotions. And emotional regulation then looks at, okay, what coping skills can I use, can I implement every single day to recognize when I feel a particular emotion? So, for example, if I can give an example, what I've done previously, and again, activities that we choose are very specific, obviously, to each client, so they will differ from patient to patient. So sometimes what we've done before is, what I like to do, for example, with an adolescent, or even sometimes with a young adult as well, is I like to start off with naming and identifying the emotion. So where in the body, what are those warning signs of when I know I'm feeling a particular emotion? If we are able to identify those, we will then know, okay, those are my alarm bells going off, those are my warning signs to know, where is my calm down kit? so I can use that to regulate and to calm myself down. So previously we've made like little calm down kits where in there might be my favorite scented candle that is soothing for me. Or maybe in there it's I'm somebody that loves downtime. I'm going to put in a coloring book and I'm going to make sure that that is in my box as well. Sometimes people add weighted blankets because they like that for comfort and that deep pressure that makes them feel calm and safe. So we've done things like that before in terms of knowing how to de-escalate the intensity of an emotion by using these coping skills to bring in the calm, to make the person feel okay or manage the emotions.
Absolutely love that. So you talked about tools that people might have, and you mentioned part of them. You called it a kit. So it sounds like, everyone needs one, sort of like a distress tolerance kit that they can have with them. And I know, Thaakira, that people can, you told us your Instagram handle, and we will probably attach it in the description box as well. You also sell nice, tools for adolescents to help them with emotional regulation. But what I like, my favorite in that toolkit is the emotional wheel. Where you get the adolescent or whoever is using it to come to a place where they name their emotions. So just talking a bit about emotional regulation, a lot of people do not accept their emotions. They reject their emotions, but I feel like they reject them even before they know what these emotions are. So from your perspective, what would you say is the importance of being able to name emotions?
Sure. I think, what's important about being able to name emotions is that I often say that if we are able to at least name the emotion of what we're feeling in the moment, if you can say, I feel sad, already the brain registers to know that that is the emotion that is being felt. It creates almost that awareness that I'm getting in touch with my emotions, and automatically we know, okay, where's my toolkit to cope and to manage with those emotions. So I think being able to name an emotion creates that awareness to the client of learning, because sometimes people even struggle to name that emotions. So at least the emotions wheel can increase the vocabulary with regards to what other emotions am I particularly feeling, because often we resort to words like I'm feeling okay, or I'm feeling fine, or I'm feeling good, but we don't always know what those mean. So automatically we also sometimes go into autopilot mode and we don't even know what emotion in that moment we are feeling. So creating that space is a practice of mindfulness, a sense of being present in the moment so that we can name those emotions.
I love that. They always say you cannot tame what you cannot name, right? So if you want to tame it, you must name it. And you must be able to get for your own self a way of calming yourself down. And I feel like that's the challenge you're bringing to us. And I want to say us, because this is not just something that's done for, mentally ill patients.
Absolutely. No. On a daily basis, I even need to use my distress toolkit, and I'm sure you can relate to that, Sibo.
100%. So can you give us tips, what distress tolerance skills are there, or emotional regulation skills? Maybe give us your few favorites that people can connect with. If someone is feeling very overwhelmed by their emotions, they've named it, I'm feeling very angry right now, what can they do to sort of calm themselves down?
Sure. So what I often say is remember I spoke at the beginning a little bit with regards to knowing where in your body you feel those emotions. And I often say the body knows first how you're feeling. So that's how I say, when my warning signs go off, such as my heart beating fast, my hands are starting to shake, I'm getting a little bit hot, okay, that's my warning sign to just stop. Okay, so I like to implement the stop skill. It's a DBT skill or a distress tolerance skill. I love it. It's quick, it's in the moment. And what you do is you stop, you take a step back, you recognize what is happening around you, where in the body you're feeling that emotion, and then you use certain tools to cope and to manage. So some of those tools that go alongside the stop skill would be quick tools such as the tip skills. The tip stands for temperature, okay? So being able to use something cold, okay, to regulate. So whether it is that I take take some cold water and I splash it on my face, whether it is that I hold some ice and I take that ice and put it on my forehead, or I put it at the back of my neck to quickly de-escalate and bring my body temperature back to normal, okay? Which would be intense exercise, maybe if I have access, you know what, or not even just intense exercise, but just movement, you know, sometimes just a movement break in that moment can also help to bring in the calm quite quick. So maybe I just need to remove myself from the environment and pace up and down, and that can help to bring my breathing back to normal again, or make me feel calmer again. Another thing, another practical tool is breathing exercises. So I like to often teach the one, because I practice this one as well, the hand breathing. Okay, so if we breathe in the shape of our hands, breathing in and out through the shape of our hands can also help and bring in the calm quite quickly and efficiently. That is just a few. There is so many more. Sure, I can go on and on, but yeah, but those are just a few practical tools that I think targets the nervous system very quickly to bring in the calm. Yeah.
Thank you so much. I think, people will really, really appreciate that. It's like quick and easy, accessible. I like the breathing through your hand. As an example, because, and you see, you don't have to reach for anything outside of yourself.
Absolutely.
The hand is here next to you, and you can just use that. Okay, and if people want to know more about emotional regulation, distress tolerance, do you have any resources, or would you
Yes.
What resources?
So if you want to know more about emotional regulation, I do have quite a bit of resources. So I can you can pop me an email, pop me a WhatsApp, reach out to me on social media, and I can share those resources or ideas of sometimes maybe even not for yourself, but for your family as well. So I can give you some insights with regards to that as well. So absolutely, I have some resources. And then also I've actually, in my Calm Down kit that I've designed, I do have 2 booklets that have activities in them which are targeted at emotional regulation. So I do sell those books on its own as well. So if that is a resource that you even want to practice at home with your family or whatever the case may be, reach out and I can definitely make that available for anyone. Yeah.
Yeah, I love that. So people can actually just come to buy the kit or the booklet because they just want to teach themselves how to regulate.
Absolutely.
And why is it important that we regulate ourselves? I know we're spending a bit of time on this now, but why is it important?
No, that's no problem. I think it's very important because if we don't regulate ourselves, if we don't learn to regulate ourselves, we make ourselves susceptible to environments that could blow out. And I think if we having a conversation, or if we speaking to our spouses or speaking to a family member and we notice that our emotions are starting to flare up, we're not going to get anywhere with that conversation because then the emotions are going to be doing the talking. So being able to manage our emotions is fundamental so that we can actually thrive within everything that we are required to do. So being able to be regulated is important so that we can be functional human beings, because if we not going to be able to regulate ourselves, it might impede functioning as well.
Sure, I love that. So back to how we started, we're talking about a functional human being. And this is a Flourish Community podcast. So we're talking about people flourishing here, right? So you to be able to flourish in your everyday life, you need to be able to self-regulate, regulate your nervous system, regulate your emotions, so that you can have meaningful connections, and you can be able to come back to yourself, right, and see fruit coming from your life, because you're not engaging from a level of high in emotional intensity. So we're not saying minus your emotions should not be part of your story, but we're saying your emotions should not lead you, right? That's why you need to regulate. It's data, emotions are information. So once you know, okay, this is why I'm feeling this way, how can I bring myself down? Thank you, emotion, for telling me that. Thank you for letting me know. Let me, bring myself down so that I can engage meaningfully with other people. Absolutely love it. And I love those resources. I've used that Calm Down kit. I actually purchased it for my kids because this is how much I believe in this stuff, because I feel like these things should be taught. And as if we know our history as this generation, our parents didn't know most of the stuff, so we need to go and get the information so that we can apply it for ourselves, which makes us better parents. But once we are regulated, then we are modeling how emotional regulation looks like, and we can also give it to our kids and teach them. So thank you so much for those tips, Thaakira. So as we round up, I'm wondering, when I look at occupational therapists, I'm always thinking about recovery, right? Because sometimes psychiatrists come in and we give them medication, the psychologist is talking and they're looking at the trauma it's nice, right? They're gaining understanding of themselves, but in the end, they have to be discharged. They have to go home. In the end, they have to go out and live their lives. And when I think OT, like, it's always like, how do people live their lives more effectively? So any practical tips that you have for families or even carers that are supporting people with mental health needs from an OT lens, or someone who is currently struggling with depression right now and is in that recovery phase? Any practical tips that you could?
Sure. I love this question because I think it's so important. Sometimes people are still afraid to reach out. So I think even the little bit of information or tips that we can provide, even on this platform, would be helpful. So I love this question. And just to name a few practical tips, I think to first start off with, really try and encourage and facilitate participation in activities that the person enjoys or that gives them a sense of purpose. And these things could be things like hobbies, whether it is reading, music, coloring, playing an instrument, going for walks, being in nature, connecting with other people, or even just small daily tasks as well, like getting up and making up the bed, because even that can be a challenge. So yes, that would be number one. Number two would be to have predictable routines. I think if we don't know what is the expectations of the day, it might cause, for somebody to be overwhelmed or distressed. So having predictable routines where we set up either a daily routine, a to-do list of what is the expectations of the day, whether it is that we even want to do a weekly routine, that's also okay, but making sure that we make time for self-care, for activity, and for rest, So that would be number two. Number three, if someone is feeling overwhelmed, make sure to break down those large things or expectations into smaller steps. So if I have the expectations that I was going to make a big meal today for the whole family, but now I'm feeling so distressed, okay, break it into smaller tasks and be like, you know what, I'm not going to make that big pot of food any longer. I'm just going to make sandwiches for everyone because that is what my capacity can manage today. And that is okay. That's teaching yourself tolerance to manage what your energy levels can actually do within that day. Okay. Another thing would be encourage the family member, the friend, to do as much as possible on their own. I know it's easy for us to just go and be like, no, don't worry, I'll do it for you, or whatever the case may be. But we want to give them a sense of competence. We want to give them a sense of independence. So as much as possible, yes, of course, provide support, empathy, and understanding, but as much as possible for them to be actioning whatever the task is that is required of them. Also, recovery is a journey. Okay, there are moments when there are ups and downs, and knowing that it will get better. So knowing that if you're just there and you're present and you ask, okay, what is it that you need? That is enough to get the person going. And lastly, don't be afraid to reach out. There are many mental health practitioners of not, of course, obviously I'm going to be biased and say, like myself, occupational therapists, but there are many mental health practitioners that you can reach out to seek support, not only for the person that is struggling, but even those that are supporting those people. So knowing that you are not alone as well, is that you can also reach out if you are struggling or suffering. That would be my key practical tips for family or carers.
Love it. And I think I like that you touched on support for the caregivers, because often caregivers don't know how to support if they have family members who are struggling with mental challenges, like, am I doing enough? Am I doing too much? But I think with those tips, encouraging self-efficacy, encouraging self-competency, even as you help, and is very important. Well, Thaakira, that was very insightful, and really grateful that you could make time to come. I think, you've said some really great points there that people can learn from, and this is just starting the conversation. I mean, there's so much you can still talk about. Probably we'll have you again to dig deeper into recovery, talk about workplace stuff, right? And how OTs can be involved in that. There's just so much more that
sorry to cut you, Sibo, but I think, and that just shows how fast OT is. So if we go back to the first question of if we were to describe the role of an OT, sure, if you think about a human being, they are a fully functional being within different areas of their life. So there are many areas to explore with the patient, and that in itself just is not even a little bit, but a little bit of info with what an OT does.
I love it. Do you think OTs are misunderstood? And the general public, what do you wish more professionals or the general public would understand about OTs in mental health? Maybe just one thing that you just like. Okay. If you were to leave with anything, or two things is amazing. If you were to leave with anything from this talk in your understanding of OT, these are the things.
Okay. Number one would be, it's not just about thoughts and feelings. So I think what's key here is our ability to engage in meaningful activities, which significantly impacts the mental well-being, and we can address that link. Okay. Number two would be, which is a big one that gets really misunderstood, is that OTs is not just about arts and craft or keeping somebody busy.
I love that you talked about arts and crafts, because how can we speak about an OT and not do arts and crafts? Love it.
So that would be sure. It's one thing that is really misunderstood. Yes, and we do use activities as a means. So in all of our sessions, you'll see us doing specific activities within our sessions. We won't just be talking, but our interventions are evidence-based, and it's goal-directed towards meeting the needs of the client. So when we are painting, we're painting with a reason.
Painting with purpose.
Yes.
Oh, I love that. So can you just please also just remind us again how people can find you on social media, your practice? I see in Feb you ran a mindfulness workshop. What other things do you have up your
Sure.
sleeve this year and how people can get in touch with you?
Sure. So I have lots of ideas in terms of what I am wanting to do still for this year. One of them being that I'm actually going to partner with a colleague of mine, and we're wanting to run some outpatient groups as well. So we know, especially for adult patients that is in the substance use unit, we want to have almost like a recovery kind of outpatient group. So that is in the work in progress. I also want to launch some new activity or resources, which will also take some time, but definitely going to do that. And what I've done before is I've ran a mindfulness group, which was absolutely amazing, where we practice a little bit of mindfulness in the beginning. And then we use an activity for the rest of the duration, which was mindful painting, mindful beading, diamond dotting as well, different activities, and knowing finding new hobbies as well that a person might want to try out. All of this is available on my social media page on Instagram. You can find me by Thaakira_occupational therapy. Pop me a DM, pop me a WhatsApp message, reach out to me via email. And we can just chat if you or reach out or I can even pass you on to someone else if needed. But even if you just want a space to chat, I'm struggling with this. Who do you think I can meet with? Or just please reach out.
Amazing. So do you do online consults or just face-to-face?
I do a combination of both. So I do online as well as in person. So whatever is easier for the client.
Okay. No, great stuff. Thank you so much, Thaakira. I really appreciate you making time to join us on the Flourish Community Podcast this week. Thank you just for sharing all this insightful information. Any last words? This is the final one. Like to someone who's struggling right. This is like the real final one. Someone is struggling right now. What would you say to them?
Sure. I think there's so much that one can say, but I think just to recognize and to take it small steps at a time. I think we don't value how important breaking down a small thing of just setting a small goal of, I just want to get out of bed today. And recognizing that that is a win, recognizing that that is a sense of accomplishment that is worth celebrating. So even if your main goal today is just getting out of bed or even just taking a shower and washing my hair and feeling good, and that is it, that is a win and it is worth celebrating. So don't forgo the small little accomplishments because those are actually the main victories.
Oh, that's beautiful. Thank you so much, Thaakira. We hope we can have you again pretty soon. And it's lovely chatting to you. As I said, I promised you that this was going to be one conversation that was going to equip you. I hope you really enjoyed that. And like Thaakira said, we shared all the information in the description box down below on YouTube and also on our podcast platforms. Please follow her on Instagram. Find out, how much it costs to see her and find out what resources she has available. She's very open. And with that being said, it's a wrap for this week's episode. God is kind to you, friends. Be kind to yourself and be kind to others. Until we meet again next time.